give us a call, because here is a question. Are too many people claiming benefits? The number is 027 862 2222. That's the number you need. Let us know your thoughts, because new figures show that a record 8 million people are on universal credit. That's the highest since the benefit was introduced more than a decade ago. The steep rise has been driven almost entirely by people who are not required to work. 3.7 million people make up this group. Now, these people could be off work because of long-term sickness, because they might be over the pension age, they might be having a baby, or they might have a baby under one, because they're considered to have no prospect of work. There's been a rise among older and prime age workers, with over 55 seeing the biggest jump in being signed off without having to look for work. And the government previously said it inherited a broken welfare system. So here's a question. Do we need to make it harder to claim universal credit? I'm going to go to you, Anne, but I think people at home need to know exactly what universal credit is and how much it is. The basic level of universal credit is £400 and 14p a month. That's for a single person aged 25 and over. Should we stop that credit? I mean, I wonder, it's always a question that's asked of spokespeople and politicians whether you could live on that.
Indeed, it is a question that is asked. But I think what I want to look at is this, and I think it's important. Yes, 8 million is too many, but you've got to ask, why is it happening? You know, and I think there is a mix. I think undeniably, you know, Labour's policy on the employer's national insurance has hit the jobs market. People aren't in work, or they're not in full-time work, or whatever it may be. But also, for years now, it's nothing to do with just Labour. For years now, the awarding of what we would call invalidity benefit, that is credit because you cannot work because you're ill or
we say it's people not required to work. That's the language now. That's right. The largest number of claimants. Yeah,
exactly. We have not been fastidious for a very long time now about assessing and then reassessing. And we simply haven't done that. And a lot of people, and this is well known, people talk about it, a lot of people are claiming who actually could work.
Right. Zack?
The audacity of a former Conservative minister to be saying that actually the problem here is people with disabilities, for people with long-term health sicknesses. We have just had a pandemic. The amount of long COVID going around where people are physically not able to work. If people could work, they want to work. Poverty is not a lack of character, it is a lack of money. And when we've had rising living standards, mass inequality is at the heart of all of our problems. Rather than tackle the inequality, Anne's suggestion here is no, let's punch down, let's tackle some of the most vulnerable yet resilient people in our society. Rather than saying, could multimillionaires and billionaires pay a little bit more?
Well, how are the Greens going to handle this? Because, you know, ultimately this comes out of the public purse. We're talking about an increase in 3.7 million people who are, I'm going to use language that Anne didn't use, but nevertheless implied, who are so-called on the sick, when a number of them, Anne makes the point, you know, could perfectly easily go to work if they could find a job.
Well, I think there's no evidence for this other than in kind of right-wing rags, but when you actually look at the data, I think it's very clear actually that people want to work, and that a lot of people who are claiming universal credit are in work, but actually work isn't paying enough. In terms of how I tackle it, I guess there's a long-term solution and a quick solution. Long-term solution is a universal basic income. So actually to say everyone in this country should have a safety net so that they don't have to worry about a roof above their head, food on the table, basic survival should be covered by the state.
Taxing millionaires and billionaires to do that?
I think that's part of it. I think there's also things like at the moment, we loaned money to private banks during COVID. We're now paying interest on that money. There's absolutely no reason to do that. That would be £15 billion straight back into the system.
That's a long-term. So what's a short-term solution?
I think the short-term solution is to recognise that actually there are systemic issues here around the National Health Service, and that if people are getting sick, it's because we have a sick population. And actually we should be investing in mental health. We should be investing in making sure that people know they can make the best decisions for them and their health.
Well, I'll just pause a second. We'll come back to you to respond to that, Anne, but I'm going to go to Pat. You're in you're in I think in Denbighshire. Forgive me, Pat. help me out here. You've got Anne saying, look, this is unsustainable. Look at the number of people who are so-called on the sick. A number of them could go to work. They're just shirking getting a job. And frankly, the people who are working and doing the right thing shouldn't be penalised and paying tax for those people. What do you make of that? Or do you agree with Zack?
Anne is absolutely 100% correct. For example, I'm 79, going on 80.
Right.
I have a terminal lung disease.
I'm sorry to hear that.
4 stents in my heart. I've applied, I got a blue badge.
Right.
I have applied 3 times for attendance allowance.
Yeah.
And I've been refused because I was totally honest and said I can go to the toilet on my own during the day.
Right.
3 times I've been refused, right? The next one, my son, 57, worked all his life, had a massive heart attack last year.
I'm sorry, Pat.
He has a disability with his knee.
Right.
And he is not even getting enough benefits to pay his rent.
Pat, I'm sorry to cut you short.
I know, just 1 minute. No, just 1 minute.
Yeah,
there are people that I personally know are claiming for everything, and they don't need to.
So, Pat, you are expressing, I have to say, Zack, what a lot of people are saying, which is, look, if you're an honest person, right, if you tell the truth, you don't really get anywhere. But there are a number of people who are frankly fiddling the system, which is why there's such a rise in people that are claiming universal credit when you really should be encouraging them out to work. You know, Pat is by no stretch of the imagination alone in her view about that. We'll come back to it. Emily, you're in Essex. Do you agree with that?
Hello. I just wanted to make a point that the universal credit has. I was on ESA, and ESA is now stopping, and it's all moved over to universal credit.
Yeah.
I'd like to know the number that they think has gone up, because all of that has been put on universal credit.
Right, so that's employment and support allowance. So it's gone up massively. So just to be clear, the steepest rise, and I want to repeat this, is a rise of 39% or 1 million since the same time period in 2024. That's the people, according to the Independent and the Standard, who are now claiming universal credit. Thanks for calling. Yeah.
No, sorry. Is that because they are no longer on ESA? I wonder how much millions that was.
Well, the answer to that question is some are, but the biggest group, it seems, and this is the conversation we're having, is that even if you're entitled to that employment support allowance, is the extent to which those people actually need that benefit, or there is a real conversation taking place where those people who in many cases have health issues should be encouraged back into work, Emily?
Those people, I am with Mind, and we do so much for the nature and getting out and helping one another.
Right.
So, but yeah.
Well, that's good to know. Now, Zack, before I come back to Anne, you know, you've called for better support of getting people back into work.
Yeah, absolutely. And a huge issue here as well is underclaiming. I think that's actually the real conversation to have here, is the amount of people who could be claiming benefits, but actually because they don't have access to the right information or their lives are too chaotic that even just to go through the same system, they can't even get that money. How deeply performatively cruel do we have to be to people who are disabled? The previous caller, I think, was making my point, actually, that people are struggling so much with long-term health conditions and disabled people who actually want to work, who want that support, but actually they can't get that support by magic. They need basic money, you know, to cover things like, you know, if they can't even dress themselves, to possibly have someone to be able to support them, to then even think about getting to work later. But the solution here cannot be to cut money away from people. And in terms of fraud, the data shows over and over again that the cases of people not legitimately claiming are so minor, compared to, by the way, government ministers, when we look at PPE contracts that have still not been tried and
very, very quickly in response.
Yeah. I mean, there's no doubt that some people need it. That's why we've got the benefit. But equally, there is no doubt that there is a growing number of people who don't actually need it.
Where's your evidence from?
Yeah, I'll tell you exactly where I get that evidence from in a minute, if you'll just let me finish.
Please.
So there is a growing number of people who are either working and claiming, or who are claiming when they don't really need it.
Well, he asked where the evidence is from.
And the evidence from that, the evidence for that, rather, is the number of cases that most people can point to that they know, where it's happening.
Anecdotes isn't evidence.
No, it's not just anecdotal, it's people actually knowing where this is going on. I've been a social security.
Not data.
I've been a social security minister, and we relied heavily on what people told us, because
that's why we're in such a mess. If you as a minister were not looking at data, but your mates
actually told us more than the raw data.
This is quite extraordinary. So you're saying you made government policy based on what people told you, as opposed to the evidence of what was
if it's
happening.
going on, yes,
That's
absolutely.
Astounding.
Well,
really?
either way,
well, you may be astounding.
We find out more what the Green Party's platform is. You heard it here. I'm not sure. First, it might be your first chance to have listened to what the Green Party has to say. Universal basic income for everybody. Where that money's going to come from, you'll have to listen into their party conference in October in Bournemouth. But later, it's the papers here and everything else. Find out why it's bad news for couples who met online. But after the break, we're asking this: should we make all schools go vegetarian? A new study has revealed it lowers your cancer risk significantly. So should we offer vegetables to kids rather than meat? 027 862 2222. That's the number.